Now we're going to talk about the eye movement system. So, precision control of eye movements is vital for vision because the best visual acuity is available in only a small region of the retina. Because in order to perceive an object as a single object with two eyes, we have to have an image of the object viewed on corresponding points on both retina. So when people who have concussions, which is really a mild traumatic brain injury, and other brain injuries, when they report diplopia, it's because they're unable to focus the vision and to precisely control eye movements in order to keep that object viewed as one single three-dimensional object instead of two objects. A lot of times when people have concussions, they don't necessarily report diplopia, but they'll report blurry vision, and so you can think of that as sort of mild diplopia, because the two images aren't exactly in sync, and that's why you get the blurriness. So really, when we're treating for post-concussion syndrome or some of the other things, physical therapists and physical therapist assistants don't do vision therapy. Occupational therapists do vision therapy. There's also a cognitive component, which can either be done by an occupational therapist or a speech-language pathologist. The PT part of that is working on vestibular rehabituation and balance. So really, it's nice if you work in a multidisciplinary setting, because then the three can work as a team. There's actually overlap between the different areas, but PTs and PTAs specifically do not do vision treatment. After a concussion or a brain injury, a lot of times people will go to a neuro-ophthalmologist and have prism glasses prescribed, which can really help with that blurriness. But the neuro-ophthalmologist doesn't do vision therapy. It's actually done by an occupational therapist. So, team approach. For things like concussions and brain injuries are certainly things that require a team approach to rehabilitation. So, normal eye movements require synthesis of information from head movements, which is vestibular information, visual objects, which is vision information, eye movements in position, which is really proprioceptive information, and selection of visual targets, which involves the brainstem and the cerebral cortex. So we have to have all those things come into play. There are two objectives of eye movements. The two objectives are keeping the position of the eyes stable during head movements. If you're unable to do that, it can result in vertigo and motion sickness. And we'll talk about vertigo more in the vestibular chapter, and we'll talk a little bit about motion sickness at the very end of this PowerPoint. The other objective of eye movement is to direct the gaze at a visual target. So, gaze stabilization or visual fixation during head movements is achieved by the vestibulo-ocular reflex, which we'll talk about in a second, and optokinetic nystagmus. And we will talk about the two different types of nystagmus. One of them is normal optokinetic nystagmus, and one of them is pathological. So the direction of gaze is accomplished by three types of movements. Two of them are considered conjugate movements, where both eyes move in the same direction, and one is a vergence movement, where the eyes move toward the midline or away from the midline. So the two conjugate movements are saccades, which are fast movements that switch gaze from one object to another. So that is where you're reading, and you hear a sound, and your eyes flick over to where you heard the sound from. So you're quickly switching from one object to another. Smooth pursuits are eye movements that follow a moving object. So those are both the conjugate movements, where both eyes are moving at the same time. So I think of smooth pursuits as you're waiting to cross the street and you're watching traffic and your eyes are following the cars as they go by. Okay? Vergence movements are where the movement of the eyes toward or away from the midline to adjust for different distances between the eyes and the visual target. So if you right now hold your thumb out and focus your vision right on that thumb, then focus your vision on a distant object, and now focus back on your thumb. So when you focus on your thumb, the eyes have to converge a little bit towards the midline in order to focus on the thumb, and then when you focus on a far target, they have to diverge from the midline a little bit in order to focus on those different distances. So a lot of the control goes towards controlling those type of movements. So saccades can be generated voluntarily, like quickly switching your vision from one thing to another voluntarily, or it can be elicited by different stimuli, like visual, tactile, or auditory, or nociceptive. So you step on a tack, your vision goes right down to like, oh, what did I step on? If you hear a noise, somebody taps you on the shoulder. So that's that old trick where you tap someone on the opposite shoulder from where you're standing to get them to look at you. And some people fall for it and some people don't. But that tactile approach causes you to shift your vision over to that side. Or you catch something out of the corner of your eye and you shift your vision over. Smooth pursuits are those eye movements following a moving object, like watching someone walk across the room or watching cars or watching a tennis game. That's a good example of smooth pursuits, if you're just moving your eyes, not your head. So a moving visual stimulus is essential for the production of smooth pursuit movements. Okay, that's all I'm going to say about that. So the vestibulo-ocular reflexes work to stabilize images during head movements. So the smooth pursuits is where you're standing, looking at the street and using your eyes to watch cars go by. If you then get your head into it, like now you're watching the tennis match and you're moving your head back and forth, the vestibulo-ocular reflex has to stabilize the image as you move your head back and forth. So the fluid-filled semicircular canals in the inner ear are our vestibular receptors, and we're going to talk about those more in the next chapter. So when you stimulate the pair of semicircular canals on either side of your head, it induces eye movements in roughly the same plane as the canals. So the canals are at 90 degrees to each other. One of them detects vertical head movement, and the other one detects horizontal head movement. So the vestibulo-ocular reflexes link that movement in the semicircular canals caused by head movement with ocular movement. So if your vestibulo-ocular reflexes are messed up, that can also cause vertigo or motion sickness. Optokinetic Nystagmus adjusts eye position during slow head movements. So say you're walking down the street and you're moving your head relative to objects in the environment. Okay? The optokinetic nystagmus is elicited by moving visual stimuli. So it allows the eyes to follow large objects in the visual field. So this is normal. This is how our eyes normally move. The way they test for optokinetic nystagmus is they have usually a cylinder that's covered with vertical stripes that's slowly rotating. And the normal response is for the person's eyes to follow a single stripe to the edge of the visual field, and then you get a saccadic movement to move the eyes to the next stripe. So, and it's sort of the same thing if you watch someone's eyes when they're reading. They go from one end to the other, and then a quick movement back to the first side. So it's a combination of optokinetic nystagmus and saccades. So that's a normal movement. So if you have someone who's willing to be a test subject, you can have them let you watch their eyes while they read, and you can see that normal optokinetic nystagmus. So physiologic nystagmus is the normal response that can be elicited when someone has an intact nervous system by optokinetic stimulation, either rotational or temperature stimulation, interestingly enough, to the semicircular canals, or by moving the eyes to the extreme horizontal position. So that's when somebody's reading in a book, you move your eyes to one horizontal side, you track to the other, and then a quick movement back to the first side. Pathologic nystagmus is a sign of nervous system abnormality, and a lot of times it is provoked not by a moving stimulus, but actually by problems in the vestibular canals. So if you move someone's head to the side, you'll see their pupils go to one side or the other. Or sometimes they go to one side and jiggle a couple times. So pathological nystagmus is different from physiological nystagmus. And pathological nystagmus can be a sign of something wrong in the cranial nerves. There can be cerebral cortex things. There can be something wrong in the vestibular system. So lots of things can cause pathologic nystagmus. Several different things can influence eye movements, influence the direction of your gaze. So auditory information, like you hear a sound and you look over at it. A vestibulo-ocular reflex, so you get some input from head movements. Visual stimuli can cause you to change your direction of gaze. Sensory information from the extraocular muscles and your emotions. So the limbic system can affect your direction of gaze. So the example is, well, say that you're reading, you're sitting on the couch reading, and someone comes into the room and the reader looks up from the book to the person that just walked into the room. So that might be auditory, it might be visual, like you catch them out of the corner of your eye. It might be the emotion system. It's someone that you love, hate, etc. comes into the room and it distracts your direction of gaze. So there are lots of different things that can involve that. So during reading and other activities where the visual object is near the eyes are aimed towards the midline to allow the image to fall on corresponding areas of the retina. So the farther away it gets, the more your eyes go away from the midline. Motion sickness it can be nausea, headache, anxiety, possibly vomiting in worst case scenario, when you experience it in moving vehicles or on a moving surface. A lot of times it's caused by conflict between different types of sensory information or by postural instability. Seasickness can be caused by a conflict between visual and vestibular information. So you look out, you're on a boat. I am one of those motion sick people. Going on a boat can make me sick immediately. You're on a boat and you are looking out at the horizon and it appears to be moving, but it's really the boat that's moving. So you're getting input from your somatosensory system that's telling you that you're moving. You're getting input from your vision that's telling you that something else is moving. And you're getting input from your vestibular system that's telling you that your head's moving. So it's like a disconnect or a conflict between that different information that causes seasickness. So I don't know why some people experience it and some people don't, but lucky people that don't experience seasickness.